If you've been told by your doctor to cut back on salt to control your blood pressure, stop, because what you're about to hear could be the difference between living a long, healthy life and suffering a stroke, kidney failure, or a heart attack that nobody saw coming. Blood pressure is the single most important health metric you can control, and most Americans are getting the advice completely wrong. The real solution has nothing to do with how much salt you put on your food. It goes much deeper than that. And if you don't understand what's actually driving your blood pressure up, no amount of salt restriction is going to save you. In fact, you could be doing everything your doctor says and still be silently destroying your arteries every single day. This is a public service announcement for every American, whether you have high blood pressure or not, because what I'm about to share could prevent this from ever becoming part of your medical history. The real way to win is to control your hormones. And if you don't learn how to do that, your blood pressure will keep climbing no matter what you eat. So why does blood pressure matter so much? Because of what happened in 2015. The SPRINT trial changed everything. Before this trial, the target was keeping blood pressure in the 120s over 80s. That's the top number, called systolic pressure, being 120 millimeters of mercury to push blood forward, and the bottom number, diastolic, being 80 millimeters of mercury or less during the heart's relaxed filling phase. Before this trial, there was an argument that treating blood pressure aggressively was unnecessary. So patients were divided into two groups. One where blood pressure drifted a little higher into the 130s, and another where it was kept below 120 over 80. The trial was stopped early because it was deadly to let blood pressure sit in the 130s over 90s. In other words, you lived longer and protected your kidneys, eyes, and other organs when the top number was in the 110s and the bottom number was in the 70s. Let's take a step back. The system we're trying to influence is a closed-loop fluid system, a hydrostatic system. There's no reservoir somewhere where you can simply adjust the pressure. Inside the arteries and veins, what matters is how much fluid is being pumped and how fast it's being pumped, and that results in a pressure. It's that pressure that causes the damage. When pressure stays high, the endothelial lining, that inner skin layer of your arteries, becomes hardened. It changes structures like the glycocalyx and increases arterial hardening by altering what those cells look like and what the muscle inside your arteries is doing. When patients present with high blood pressure, the first line of treatment is medications that slow the heart rate and relax blood vessels, because lowering the pressure is the immediate priority. But to truly outsmart the problem before it starts, you need to understand aldosterone, the salt hormone, and the superior hormone to control it is insulin. Insulin is the biggest predictor of whether aldosterone is rising. High insulin equals high aldosterone, which increases blood pressure. If you have high insulin, your blood pressure is higher than it should be. If you have a history of high blood pressure and want to add salt back to your diet, the first step is lowering blood sugar. You must address blood sugar before anything else. And don't stop blood pressure medication immediately, because a history of high blood pressure means a history of high insulin, and things can improve and then drift backwards. Keeping blood pressure controlled is something to manage carefully between you and your doctor. Without addressing these hormones, controlling blood pressure without medication can seem impossible. It is possible, but it is a slow and steady process, especially if you've been under the influence of high insulin for years.